Action!
Have you ever heard of Aurelia, who decided euthanasia due to mental illness without any other physical ailments? She experienced various mental disorders since 12, and eventually, at the age of 29, she decided euthanasia. However, could euthanasia for the mentally ill be legalized? Mental illnesses differ from physical ailments in terms of difficulty of determining the potential for treatment and the goal of psychiatric care. Therefore, I argue that euthanasia for the mentally ill should not be legalized. First, let's examine why euthanasia for the mentally ill poses problems, followed by a counter-argument related to patient opportunity. So far, we have showed the case of Aurelia. Now let's move into the issue of determining the potential for treatment of mental illness. It is difficult to accurately assess whether mental illnesses could be treated. Unlike physical illnesses like cancer, mental illnesses do not have clear stages of progression, so the potential for treatment is subjective. Quebec psychiatrists stated it is not uncommon to observe a marked improvement following an encounter with a significant other, a new treatment trial, the presence of a dynamic care team in the patient's life, or the discovery of a new meaning in his or her life. If the patient of mental illnesses choose euthanasia, they could be deprived of these future treatment opportunities. Euthanasia for individuals with mental illnesses raises not only issues regarding the potential for treatment, but also issues related to the goal of psychiatric care. Legalizing euthanasia for the mentally ill contradicts the fundamental goal of psychiatric care. According to the editorial board from the Washington Post, empowering a mentally ill person to invoke a physician's aid in ending his or her suffering inverts the most basic goal of psychiatry, which is to prevent suicide rather than to facilitate it. If the individuals with mental illness are freely allowed to choose euthanasia, those suffering from the mental disease and opting for euthanasia would significantly increase. Then what would be the purpose of psychiatric care? I have presented two reasons why euthanasia or assisted suicide for individuals with mental illnesses should not be legalized. However, some argue in favor of legalization. Some say that there could be patients who consider their situations and choose euthanasia rationally. While there may be the cases like this, there's also a risk of a confusion between those who impulsively want to commit suicide and those who rationally choose euthanasia. There is a saying, it is better that 10 guilty persons escape than that one innocent suffer. If there's even a slight chance of confusion in judgment, allowing euthanasia for the mentally ill is not appropriate. We have explored the views supporting the legalization of euthanasia for the mentally ill. Now, let me summarize my speech. I have shown the case of Aurelia and presented two reasons opposing the legalization of euthanasia for the mentally ill. There is a counter-argument that preventing euthanasia for some rational patients might be possible, but the possibility of confusion in judgments remains still. People aspire to happiness, not death. We should not eliminate their opportunities for happiness under the pretext of freedom. Thank you for listening to my speech.